Hi, I'm Dr. Matt Weed with Pediatric Ophthalmology here at the Spokane Eye Clinic. And today I wanted to answer a common question during this video. The question that a lot of parents ask us is, how do you know if my child needs glasses? Now, checking for a glasses prescription in kids is a little bit different than for adults, and I'll show you how. For an adult, as many of you know, the way that we check a glasses prescription is using this instrument here. This is called a phoropter. And it's a device that has a lot of different lenses built in, and as you know, we'll hold it up in front of your face and we'll ask if number 1 is sharper or number 2 is sharper. And just a quick tip about that, a lot of patients don't know this, but the goal of checking for glasses in a phoropter for an adult is to get to 2 choices that are about the same. And that doesn't mean that if you see 2 images that are about the same that you've failed the test or anything like that. It means that we've done our job. So that's the end point of checking for glasses for adults, is 2 images that look about the same. But for kids, it's a different story. What we're going to use for a child, and we're going to pretend that our patient here is a child, is this device. This is called a Retinoscope, and it's an ingenious piece of manufacturing, in fact, because it lets us look into a patient's eyes and without them having to tell us anything at all, check to see not only if they need glasses, but also what their prescription would be. In a pediatric ophthalmologist's office, this is typically done with the eyes dilated because it's more accurate to check glasses that way for children. So we put in dilating drops, wait about a half an hour, and then we check. And the way that we do this is by holding up different lenses in front of the patient's eye. You usually dim the lights just a little bit, and generating that light beam that you see there, and moving it up and down, and then side to side. And we check up and down first, and then side to side, and our goal is to hold up a lens that when I look through the little hole on this retinoscope here, the whole eye will just fill up with light. And when I do that, when I see that, I know that I've figured out what the glasses prescription would be if the child needs glasses. It's important to note that just because there's a small prescription measured during your child's eye exam doesn't necessarily mean that they need glasses. Some degree of refractive error or quote-unquote farsightedness or nearsightedness or astigmatism can be normal in children. And so that's one of the things that Dr. Colburn and I will discuss with you when you come in for an exam. Hopefully this was helpful for you. If you have any questions, feel free to leave a comment and we'll be happy to discuss those with you. Thanks for watching.